Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Uh, Late dumping syndrome. So, dumping syndrome is of two types, early dumping syndrome and late dumping syndrome. So, first, in the late dumping syndrome is of two types. We have early dumping syndrome and late dumping syndrome. Late dumping syndrome. Late dumping syndrome is seen 2 to 3 hours after the meal. Here, the patient here see after 2 to 3 hours after the meal, what happens is all the food that has um, been absorbed into the circulation, that is broken down, okay, and thus the glucose is utilized, and here and thus the patient will develop reactive hypoglycemia. So here the symptoms are mainly due to this reactive hypoglycemia. The carbohydrate load, because the actually normally the some of the food remains in the stomach and slowly it is absorbed, but because all the food enters the small bowel at once, all of the uh, glucose and all the nutrients are absorbed at once. So as a result, whenever there is high carbohydrate load in the small bowel, this leads to increased plasma glucose levels. These, whenever there is increased glucose in the small bowel, this is absorbed into the blood, so there is increased glucose in the blood, which stimulates the insulin, and insulin is produced. This insulin will break down the glucose, and now the within 2 to 3 hours all the glucose is broken down, thus resulting in hypoglycemia. So there is carbohydrate load in the small bowel leads to increased plasma glucose level, which will cause high insulin levels are released, which will lead to hypoglycemia. Okay, now the patient developed hypoglycemia, and symptoms of hypoglycemia like dizziness, tremors are seen. So these symptoms are mainly, this late dumping syndrome is mainly relieved by giving administration of glucose or sugar to the patient.
thank you and thank you for watching.